Hello, fellow PTAs. So, today we're going to be talking about the differences between sex and gender and how those two particular things can be affected in the medical field and how we might end up being able to improve upon some of those things. So, first off, let's kind of talk about the differences between sex and gender. So sex is what anatomically you were born with. So males have penises and females have vaginas. So in that regard, a lot of people think that sex is only two of them. But genetically, there's actually quite a few particular sexes out there. Um, you know, there are some people who are only born with one X chromosome. The X chromosome is typically one of the chromosomes that's part of women. So if you have two X chromosomes, then you're considered a female. But if you have one X chromosome, which is about one in every 2,000 to 5,000 births, that's also called Turner syndrome. But there are people out there who only have one X chromosome, kind of changing their sex in a way that is not outwardly apparent. So as I talked about briefly before, two X's is the most common form of a female. There's also another one where you have two X chromosomes and one Y chromosome. So you have two from that's typically female, and then one from the male, which is the Y one. That happens one in every 500 to 1,000 births. Then you have your XY chromosomes, which is your typical male. And then you have an XYY chromosome, which is one out of every 1,000 births. And then XXXY, which is between one in every 18 to 50,000 births. So, genetically speaking, there are about 6 different sexes. And in regards to spectrum, and we'll get into a little bit later, that can have kind of large effects in terms of medication management, and even other psychological disorders that might affect these people. So kind of flipping around over here, we're going to talk about gender. So gender refers to the differences between men and women as defined by a culture. So in our culture in particular, men are considered masculine and women are considered feminine. But there's about 6 main types of genders out there that most people are familiar with. So one of them is female, which everyone's familiar with. The other one's male, which is also well familiar with. Then you have trans, and trans people are people who do not identify with their biological sex. For example, they have male anatomy but identify with more female characteristics or a female gender. Then you have non-conforming. These people are considered like gender neutral, and they don't think that gender is real. And they typically end up like to be referred to as they or them in regards to their pronouns. Then you have another one which is kind of like a personal gender, which if you were to ask somebody, hey, what's your gender? Then they just end up saying, for example, if I was a personal gender, they ask me if I'm a he or her, I would just say I'm Adam, and that's it. A little bit on another side note, you also have people who are eunuchs, and that's considered a gender as well. Eunuchs are those who have voluntarily castrated themselves, and because they no longer have the hormone production in the testes, they feel like they're kind of free from the typical norms of masculinity in society. Anyway, so in those regards, I want to give just one example. So first example, this is my dog Demi. Demi was born female, and she also identifies as female. So her pronouns would be she, her, hers. So she would be also considered a cis female because she identifies the same all the way through. Okay, so now that we kind of got the sex and gender squared away, let's talk about how this affects us in healthcare. Since we're in physical therapy, we all kind of know that there's a difference in terms of the patient population that we have. Would you say that you serve more women or men? I think a lot of you would say that you service women more than men, or treat women more than men. Is that because women get hurt more than men? Probably not. I think women are just more likely to seek out help than men. And this kind of goes into how we should start kind of looking at men and women a little bit differently. You know, women are really good at seeking help for some of their physical disabilities, whereas men, not so much. Everyone knows about the dad with the low back that hurts all the time, right? He just doesn't want to get help for it, or doesn't think that physical therapy or medical stuff is good for him. So kind of on that, you know, we can certainly kind of just create more of an environment to allow men to kind of open up to their doctors, and even educate doctors on these kinds of things to be aware of with men, in hopes that they would give them more referrals in that regard. So in our field, if you were treating a trans person, how do you think you would have to go about that? Well, if the trans person doesn't look like their identified gender, then you just have to ask them, what pronouns do you prefer to go by? And it's always good to kind of keep in mind, since we work with people's bodies, that they might be a little bit more self-conscious with certain parts of their body than other people as well. So keeping an open conversation with trans people, I think, is really the key in regards to making them feel comfortable while being treated for physical therapy. Now, the lack of care, particularly in like the prevention, medicinal and therapy aspects between males and females. You know, males, I mentioned before, have low back pain, don't usually seek it out. Women also oftentimes will have urinary incontinence after childbirth. Both of these are really big deals, and both need to know that physical therapy can end up helping with that, and that it's nothing to be ashamed of. You know, men can end up having urinary incontinence as well, and physical therapy can help with that. So I think we're just really educating our patients, both men and female, in a very open and welcoming environment will help ensure that they get the treatment that they deserve. And in regards to medication management between the sexes, you know, we ended up saying before that there are 6 different genetic type of sexes. So it's really important to be aware that different medications and even different physical therapy treatments might affect women differently than men. Particularly with women, they have wider pelvises that typically leads to more knee problems, even some low back problems than men. So it's just good to be aware of those kind of anatomical differences as well. And in terms of like just psychological therapy, you know, as physical therapists, we oftentimes treat psychological disorders at the same time as treating physical disorders. You know, women, I feel, have a tendency to open up a little bit more about maybe past traumas or that sort of thing. Anyway, keeping that door open and making people feel comfortable, I think, is the key here. So how do we kind of take all this information and make sure we can kind of put it into good practice? Well, one is training. We can train people in terms of medicine absorption between the different sexes. In that regard, it's probably important to do some genetic testing to see if people have some of these kind of outlying sexes that I mentioned before. And that might help with medication management and even research with medication management there too. You can change clinical procedures in terms of different questionnaires for men and women too, even trans people as well. One thing that I've experienced, particularly that's been difficult in the medical field, is getting a counselor or psychologist that is of LGBT person. They're just really hard to find, and that's somebody who you'd probably want to relate with more. And so, in that regard, having diversity in your clinic would also end up helping people feel a little bit more comfortable as well. All right, thank you all for listening. I hope you have a good day and consider some of the points that I ended up mentioning before. Thank you very much.